and we need to integrate more interdisciplinary education. Now, we need to start with our family, but we can't stop there because we need also the lawyers and the economists and the engineers and the urban developments and everyone else. We need everyone to have the public health lenses. So I'm just hoping that the future of education will be more interdisciplinary, not just among our family, but also, more than beyond our family, like all the professions has to have these lenses of public health. So that's one thing, the interdisciplinary education.
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Dr. Laura Magaña. Dr. Laura Magaña is President and CEO of the Association of Schools and Programs of Public Health, also known as ASPPH. She is also the founding president of the Global Network for Academic Public Health, an alliance of 7 regional associations representing schools and programs of public health worldwide. Prior to joining ASPPH, Dr. Magaña dedicated more than 35 years to successfully leading the transformation and advancements of public and private universities in Mexico, educational organizations in the United States, United Nations programs, and non-governmental organizations in Central America and Europe. She has played a key role in strengthening academic public health research and enhanced the voice of academic public health through advocacy. She was most recently the Dean of the School of Public Health at the National Institute of Public Health in Mexico. She conferred a bachelor's in special education at Gauntlet University, then a master's in science in educational technology, and later a PhD in educational administration, educational leadership, and administration at Gauntlet University. In today's episode, you'll hear and learn more about how public health is at a pivotal moment, presenting opportunities for visibility, why storytelling is crucial to shift the narrative around public health professionals, how public health transcends political divides and is rooted in community and justice, why interdisciplinary education and experiential learning is vital for preparing the future public health professionals, why you have to stay informed and flexible in the ever-changing public health landscape, why no one is truly safe until everyone is safe, and much, much more. Excited to dive into today's conversation? Let's get started.
Hello, I'm Laura Magaña, President and CEO at the Association of Schools and Programs of Public Health, and you are listening to Public Health Careers.
Dr. Magaña, I'm so excited to have you today on the show. Welcome to the podcast.
Thank you, Mari.
Yeah, I'm very excited. Okay, I'm going to just jump into things. Tell us, how do you identify, and tell us a little about your personal background?
Absolutely. Well, I'm a Latina leader, Mexican-American by birth and residency, but a global citizen by choice. I love to travel and enjoy learning about people's stories and cultures. So I'm so happy to be here, looking forward for this conversation with you.
Yeah, likewise. And just to jump into this, you have a lot of expertise as we'll go through in your career journey. Or if anyone wants to look up your LinkedIn profile, you'll see that you've done a lot of amazing work, not only here in the US, but all over the world. In the pre-conversation getting into this, you frame this period for public health as an opportunity rather than a setback. Why is this the right moment to highlight the often unseen public health workforce?
Well, that's a great question, because this is a pivotal moment, because public health is really at a crossroads. So while all this political uncertainty and policy changes make us concerned, they also present really an opportunity to reinforce the essential role of public health professionals and make visible their contributions to society. So the workforce, the public health workforce, has long operated behind the scenes, preventing diseases, improving health outcomes, and ensuring community well-being. But the public health workforce consists of humble, quiet warriors who work tirelessly behind the scenes to keep people safe and healthy. Well, public health success is invisible until, of course, the system breaks down, right? So public health is often not noticed until a crisis such as a pandemic or a hurricane occurs. Well, no, we need to change this. Now more than ever, we must highlight their contributions, make visible the invisible, so the population is aware of the incredible work these people do to keep us all healthy and hopefully solidify public health as a bipartisan, long-term investment rather than a reactionary service during crisis. So that's why I think it's extremely important, really, the current times.
I love the framing around this is a necessity bipartisanly. Like everyone needs to get on board that public health is essential. And I think too often, as you stated, like it is an afterthought or we are just the people in the background, but we need to take charge of the narrative to show that we are valuable and public health is so important to the health and the well-being of this nation.
Exactly, Omar. That's exactly the thing that we need to be doing right now.
And shifting a little bit to think about like public perception, how do we shift the narrative so that public health professionals are seen as everyday change makers rather than just crisis responders?
Right. Well, I think that to shift this narrative, we must tell more stories highlighting public health professionals because we are behind the scenes work, right? So we need to stop that and we need to really start telling people what do we do. So public health professionals do far more than respond to crisis. So they are foundational to our daily well-being, and we need to really tell those stories. From reducing infant mortality to combating the opioid epidemic to preventing infections. So our work saves lives in ways that many may not even realize. So we must tell these success stories consistently, demonstrating how public health improves healthy longevity, equity, overall quality of life of everyone. So we also need to start engaging more with the media, leveraging social platforms, and fostering community partnerships. All of these can help make all our contributions more visible. We must communicate better with more clear, relatable messaging that really relates with all the people. We need to address misinformation. We need to promote trust and all key strategies really we need in order to change the public health perception. We need to change the public health perception. We recently actually in ASPPH released an updated version of our messaging guide that you can, all our audience can look in our ASPPH website in order to really learn more about what are the key messages that we need constantly to be reminding everyone. So I think that that's some of the strategies, Omari, that require.
And I appreciate the highlighting of the stories because stories are what really resonate us and connect us as human beings and to the unified narrative that we have here on Earth. And I think being able to share those stories and share the impact and like resonate and say, oh, wow, that could have been my community. That could have been, and I just understand that I think is such an important narrative to really push forward.
Absolutely. I'm with you on that.
And then with your perspective as president of the Association of Schools and Programs of Public Health, talking about workforce resilience, I'd imagine is a conversation that you'll talk about a lot.
Yeah.
What are some of the strategies that we can use to strengthen the public health workforce, particularly given funding cuts and increasing global health threats?
That's a big issue because investing in public health workforce means investing in our collective future. So that's the story behind what we do, right? So we must prioritize several things, but I will just name or list some of them. So for example, sustained funding. So right now, the way it works is that we have episodic crisis-driven investments, right? So you name it, you have the like, for example, the COVID-19, there's a lot of funding for that. We have the hurricane and we have funding for that. So those are episodic funding. We really need more like to change that circle to a circle that's more of a virtuous circle, right? Where really the funding comes the whole time, because we need prevention and we need promotion. And of course, the crisis will gonna come and we're gonna be ready for that. But the funding has to be really constant. So really trying to advocate for sustained funding is key for the things that we do. Another thing is that we need to really do more to really have stronger academic and public health partnerships, right? To really equip like our professionals with real world experience, and they can have the experience when they work in their communities. We need to also think about the workforce well-being. They are really burnout. There's a lot in their place. Even when we have the COVID, at that time there were several surveys in place, and one of them were talking about that 1 in every 5 employee so they were already showing stress and really symptoms, and then 56% of them already reported being stressed out. So we really need to pay attention to their well-being. So we not only need more public health workforce, but the one that we have, we need to protect them. We need to really take care of them. The other thing that our public health workforce needs, to be resilient is, of course, development. We need to train them. We need to expand all the training programs like on-the-job work. We need to offer them tuition in order to support their continuing education, creating career pathways to attract and retain talent. A lot of our public health workforce, they don't have a training in public health. As a matter of fact, most of them, they don't. So we need to really continually really working with them and training them and being with them on the job in order to support their work. We need to do more cross-cutting, like cross-sector partnerships, not just rely on the government, but in the private sector, in foundations and in others to really support our work. Right now, more than ever, we need these cross-cutting, cross-sectoral initiatives and partnerships. We need to communicate better with our communities and be more engaged with our communities. They are great people and organizations on the ground that, if we partner with them, could be great in order to really together have a support and network community. So those are just some of the things that we can do in order to really be more, supportive of our public health workforce.
Well, I appreciate you highlighting that, and I think it goes to show the opportunities that are out there for people in public health to create new ways to support the workforce and to create more of a thriving workforce, because there's so many different parts that are needed, and we need people that are thinking about these big issues. And I think that sustained funding is so important as well.
Absolutely. But we need everyone to be just thinking about a career in public health, because the future is us. As long as we have humans, as long as we have a planet, we need people, we need workforce in public health that really can help us really continue living and being healthy. So yes, you're right.
Yeah. Absolutely. And it all goes back to like that storytelling and that narrative to really get public health and show the importance and why it is not something that should just be pushed to the side, but should be maybe one of the first line items in the budgets when we're thinking about this kind of work.
Mm-hmm. Absolutely.
And then, given your leadership in academic public health, what are the biggest shifts you foresee in preparing the next generation of public health professionals?
Oh, that's great. Well, I think that the next generation of public health leaders must be adaptable, data-driven, and prepared to address complex health issues in a holistic and global perspective, right? So some of the things that we need to really emphasize in their education, again, I'm going to just be listing or commenting some of them, have to include, like, for example, more interdisciplinary education. We really need, we need to realize that we come from a very silo-oriented discipline. So public health is here, nursing is here, physicians is here. So even among our family, which is the health professionals, we really are silos-oriented, right? So public health has to become more like the glue, more than the center of all these health professions, and we need to integrate more interdisciplinary education. Now, we need to start with our family. We can't stop there, because we need also the lawyers and the economists and the engineers and the urban developments and everyone else. We need everyone to have the public health lenses. So I'm just hoping that the future of education will be more interdisciplinary, not just among our family, but also, more than beyond our family. Like all the professions has to have this lenses of public health. So that's one thing, the interdisciplinary education. The other one is policy and leadership. Oh my God. Our graduates have to be really key in really advocating and being very active in these issues, in this arena. So they need to feel very comfortable if they have the competencies to really move forward in very challenging environments like the one where we're living right now, and that we will continue to have. And we need to have really that background that our students, our graduates, have these really competencies. Another thing is the global perspective. Our students need to have the global perspective, right? Addressing really the health disparities around the world, we need to really, yes, act locally, but think globally. We all know that all the solutions around the world, they need, the global community, and we need to come together as a global community in order to find solutions for our planet, solutions for our humanity, and we need to do more of that. In terms of education, I think that experiential learning is key, because our students, they need to really learn on site, really having more expertise in the field work, in the internships and simulations and everything that is related with real work experience. And we're moving towards that. We have been in education, in higher education, talking for years about this, but we need to really move forward more rapidly towards really having experiential learning in all our degrees, in all our educational enterprise. I would say that technology and AI, integration, innovation, we need to be really, in top of all these things. There's so much that we need to learn in terms of technology and innovation, that we need to embrace it, and we need to use it. We need to be better at it, and we need to really be able to use it for the well-being of everyone, right? So also, all of these things are things that, of course, our community and beyond our community in the health professions, we're talking about, that education has to really embrace all these trends. So just to say some of them.
Yeah, once again, thank you for your thought leadership and understanding on this, because I think this is a question and a thought that people are having as they are especially entering the public health, like getting a degree right now in public health. They're thinking about how am I and how can I prepare myself for this shifting landscape, and how can I continue to accelerate my career and find my path in public health. And I think it's so important that you're mentioning that we need to continue to build out experiential learning, and we need to, and I think we oftentimes miss the advocacy part and thinking about how do we come together as community, as public health professionals, and really build out that. And as I think we always talk about the interdisciplinary part of public health, and how we do a good job in some ways, but there's so much other ways that we can expand and build more partnerships and really build more robust public health solutions. So I really do appreciate you sharing all of that.
No, absolutely. Happy to do that.
And then before we get more to your academic pathway, I would love to know, what does public health mean to you?
All right. Okay, well, public health is the foundation of a thriving society. For me, it is about ensuring that every person, regardless of their background, has the opportunity to live a healthy life. For me, public health is a commitment to science, to community, to justice. It transcends political divides and is rooted in the idea that our well-being is interconnected. That's why it's my passion for global health as well.
Yeah, absolutely. And I appreciate that. And I think just thinking back to like the pandemic, and when we think about like some of the global health cuts that are happening, and how a lot of these issues are not just isolated to those communities across there, but how we are all interrelated, and we are all in the struggle for better health. And really, I think considering that global perspective is important, and I'm glad to like kind of have your perspective on that, as with your experience working in the global workforce as well.
No, absolutely.
Okay, so before you were president and CEO of ASPPH, You did a lot of different work. I want you to walk us through your academic pathway from your bachelor's to working at the Ministry of Education, to then pursuing a Master's of Science in Educational Technology, to then a PhD in Educational Administration, Educational Leadership and Administration.
Oh my God, you make me now transport to, my whole career. And thank you for that. Thank you for that, because, in our everyday lives, you just you just continue going, moving. And when you stop and you reflect on, oh my God, what I have done in this, 30, 40 years, is like how life has really, every single thing has shaped how you are today, or who you are today. So I actually started in special education, as you mentioned it, and I was at that time I was intrigued by the science behind how humans learn. Let me tell you that my passion is education. That my background is in education, and really my heart is in education, right? So I started there. I started in special ed just because I was intrigued. I wanted to learn more how humans learn, but even more intrigued about how our brains really adapts and uses like different parts to accommodate and still learn and thrive if you have special needs, right? So being a scholar in learning in the human brain and how we learn and the cognitive science, I really wanted to learn more about what if you have, this special need in one area and another. And I was fascinated with that world. And for many, many years, I stayed in special education. And some of I would say my takeaways from that first stage of my career was like, first of all, knowing that everyone can learn. Everyone can learn. It is about the opportunities you give or you put in your environment in order to really ensure that learning can happen. But learning can happen every single time if you given the right conditions to learn. That's why I think that the very first things that I really learned at that time. But then I have always have like a curious mind. So I keep on wanting to study more, right? And to learn more. So I had the chance to continue and the great privilege of continuing to graduate education, which unfortunately not everyone has the opportunity to continue their education. I was one of them, and I'm very grateful for that. And I'm talking about the 80s. So in the 80s, I was intrigued by technology, how technology can be used to enhance your learning. So that was 40 years ago or something like that, when nobody talked about, of course, on learning, on education in terms of online education and technology and all of that. But at that time, a few things started to show up, and I was always, the first computers, and I was always fascinated. So that's why my master's degree is in educational technology, trying to learn how technology can be used. And you can notice that I started actually I did my graduate degrees in a fascinating world, which was Gallaudet University. So Gallaudet University is the only university in the world for deaf people. So all the careers you can study there. So deaf people from around the world come and study their undergraduate degrees, and then the master's and the doctoral. It's a huge university. Actually, it's in here in Washington, D.C., where now I'm living again after 40 years. But at that time, with my graduate, because I was in special education, I was very into that. So I decided to study there. My master's degree, which was more in how they are using, the technology, and then of course my doctoral degree, which was in leadership, because I have always, since my very first position, when I was really early in my 20s, it was in a leadership position. I was asked to lead a team to come up with a vision of special education, and then really implement a strategic plan. So I have always had really leadership positions, but at that time, I really wanted to learn more about leadership, right? About the theories behind it. How can I really continue researching more about effective leadership? That's why my doctoral degree was in leadership. And of course, education, because I really wanted to continue leading education and initiatives. So all my studies, like from the undergraduate to my graduate, was at all that those time I was in special education. Until then, I started to change. But yeah.
Okay. Well, thank you for sharing that. I would love to learn a little bit more about. So your master's, you said, was at Gauntlet University, a university for deaf persons.
Mm-hmm.
Can you give us like more of that thought process of why you chose to pursue this school, and maybe what that experience was like?
Was incredible experience, because I was really fascinated to live with the culture at Gallaudet. So at Gallaudet, it's where the two or more words find a space and a community, which is the deaf people and the hearing people, right? And we were there to build community. Of course, I learned American Sign Language, because a great thing about the Gallaudet community is that regardless if you're deaf or hearing, you have to learn and use American Sign Language while you're on campus. So maybe you and I were hearing people and we were, chatting in the garden. We have to use, I mean, of course, our voices as well, but also signing. And I find that so respectful, because that wasn't respectful for the other people that were just passing by, right? They were deaf people there. So the whole community is really very respectful and really thoughtful about thinking about the other and how to communicate with the other. And that really stick to me until now, right? It was just fascinating just to be, I was there like around 4 years, and it was really incredible time that I was able to not only have my graduate courses, but I was teaching Spanish. I was teaching Spanish with American Sign Language. So that was interesting. That was really interesting, because I learned the American Sign Language, but then I was teaching Spanish in the undergraduate education in order to really support my studies there. But that was great. And I think that really marked my life until now, in order just to be able to know that there are people that have different abilities, different competencies, and yet everybody can thrive. And I had colleagues, they were just incredible colleagues, incredible faculty that really thrived just because they had the opportunity and they had the means and they have the environment that supports them in order to really to thrive. And I think that that's when I started to actually look into the social determinants of health. That actually later on, I was able to name it. I mean, at that time, I was just like, oh my God, but those were the social determinants of health. And that later on, that I'm going to talk a little bit about what I did with UNICEF, continue there. But I started, I think, when I was living in studying at Gallaudet. Yeah.
That truly is beautiful, and I could imagine just how seen deaf people feel in a space like that, where everyone is signing, and because I could imagine just in the everyday world, they don't have environments that are like that are created for them. So that's really beautiful, and thank you for sharing that.
Absolutely.
Yeah, and you alluded to it. So you did some work at UNICEF as a consultant for the Educational Program for Development. Tell us about that work.
Yeah. Well, I was in my doctoral thesis. I was already with all my work done in the doctoral degree, but I was just writing my thesis when I went to live in Belize. And that was very interesting, because I spent there like a year and a half working with UNICEF as a consultant. And I was asked to write the situation of the women and children in Belize. UNICEF does this every 5 years in every country. So that was fascinating, because that was actually my first encounter with the practice of public health. You notice that until now, I didn't say I didn't study public health, right? So I came to public health from my educational background. So my first encounter with public health was in the practice of public health was actually in Belize, working with UNICEF. So when I was writing the situation of the children and women, I really was shocked to see the scarcity of many communities around the country and how the social determinants of health shape their future and destiny. And that really broke my heart because I said that, I was in Gallaudet before, right? So I saw how when you have, the possibilities, when you have the tools, when you have a supporting environment, you thrive. But then I was able to go to exactly the opposite thing, right? When you don't have anything, right, for the kids. So it doesn't matter that the kids, they were not special, with not special needs, but they do have such a scarcity of resources that they were so limited. So they didn't have education, they didn't have enough food, they couldn't have a school close to their houses. So then I really was more moved toward understanding how the social determinants of health can really mark your life and your future. So I think that that's when I really started to really understand more how the social determinants of health can really determine like your future and of course your health. Yes. So that's what I did there.
love that. And it's always cool to see like how people get introduced to public health or public health concepts, because many times we kind of like have a feeling for the disparities and inequities and social determinants of health, but we just don't have the words to describe it. So and I always think it's interesting to see how that develops in people's journeys.
Yeah, absolutely.
Awesome.
Mm-hmm.
And then after your PhD, you worked as an executive director at the Mexican North American Institute of Cultural Relations and the dean of the School of Education of the Universidad de las Américas.
Right.
Tell us about that experience. How do you get there? What do you do?
Absolutely. Well, you know what? I think that really life is a journey, right? So the important is not the destination. We always think about, when I graduate from here, when I do this, when I do that. But really, now that I'm looking back, like at 40 years of life, it's really you see your life as a journey, right? So everything you do builds up and influences what you are today. So of course, as any journey, you have ups and downs. Sometimes you win and sometimes you learn. I love that phrase because you always learn, right? So I like to also think about life as a marathon. It's not a sprint, it's a marathon. So you are here for the long run. So you go through life really taking the opportunities that life brings you, getting out of your comfort zone, which I have repeatedly done over all my career, because you can tell that I was in one path, and then all of a sudden, like life and the opportunities reached me and said, and I was like, oh my God. And you're going to see a little bit more like why when I get to actually to public health, and it was totally out of my comfort zone, right? But I did it. And and that's one message that I want to pass to your audience, because I think that sometimes we get very comfortable where we are, right? And we're really doing a lot of great things, and that's awesome. But you cannot grow if you don't go outside your comfort zone. You have to risk. And actually, I did that several times in all my career. And then you need to create the future you want for yourself too. So in my case, really all my previous positions really have impacted me who I am today, right? I like to think that I have here my toolkit, and I always have like, what do I need for now? What do I do? How do I develop this resiliency or this communication skill or this whatever? And then you look back and say, at that part and that point. So yes, those. At that time, when I came back from UNICEF, I continued my career as a leader, but now in more academic situation, like in the University of the Americas and also in the Cultural Institute. So I was just continue, I'm guessing, my career as a leader in education, I would say.
Love that. And what were some of the roles that you did as the executive director?
Well, I was, we had students, so recruiting students all over the world, and we were training the faculty as well. And of course, doing a lot of cultural exchange opportunities between at that point with the Mexican American with the United States and Mexico in the Cultural Institute, and not only students but also artists and a lot of the cultural that that passes around the two countries. Mm-hmm.
And maybe to backtrack a little bit, so coming out of your PhD program, maybe what were some of the ideas of the career or the work that you'd be doing when you were coming out of your PhD program?
Well, I was just more concentrated in the leadership position as opposed in what's the field. And because I always love education and higher education, I think that I have always had like this one foot in the higher education space because I love to work with students and with the faculty and just to continue in higher education. So I think that I just went back to some opportunities in higher education. I think that I had, that's what marked, I think, all my career.
Okay. And as we mentioned and alluded to throughout your story, you've had a lot of work in global settings, including in Denmark, Mexico, the US. What did you learn about education and public health across those different cultural contexts?
So what I have learned, because I have lived in different countries with different cultures, different people, and one thing that I have learned is that we all strive for a healthy life for ourselves, for our families, for our communities. So it doesn't matter where you are. It doesn't matter. That's a common goal that we all have, right? So around the world, there are really outstanding examples of effective programs that have really led to very positive outcomes, right, in their own countries. I can tell you from Denmark and from other countries. But likewise, there are also cases where initiatives has failed too, right, around the world in our communities. So this is why, I think that the global collaboration is really essential. We need to learn from each other in order to avoid repeating the same mistakes. So that's one of the objectives of really the global collaboration. But also, our world is deeply interconnected. Well, I learned that as well through experience. We are so alike and we are so connected, right? So no one is truly safe until everyone is safe. And we really need to remember that. Because sometimes we think that, we need to help this other country. No. It's not about helping. It's not about, it's because we all are so connected that if we not do our best for everyone, it doesn't matter in what country, at the end, we're going to be suffering. So we win when we help them. Everybody wins. It's a win-win situation. But everybody loses if we don't care about the others, right? Because at the end, it's one world. It's one planet. We're all together here. Anyway, so you and me know that viruses and natural disasters, of course, they do not recognize borders, right? They don't stop in the border. So they affect us all. So really to address this really, we have shared challenges and we must work together across nations to find really lasting solutions. So that's why the global health space is such an important thing of public health on the world that we do to ensure really, that humanity can persist and the planet can continue thriving.
I love that. And I think it just underscores the importance of we are all in this together because we've built this world to be globally interconnected. And in doing so, it has created new problems where diseases can pass more easily. And it is so important that we do frame it. And it's not those people over there, but we are all in this together. And how do we continue to ensure that those people and communities that are most marginalized and most vulnerable are able to thrive, and how can we do that collectively?
Absolutely. Yes.
Love that. So the experiences that you had in those countries were, and you can talk about these collectively and your journey through it. You were an education consultant in international affairs in Invest in Denmark. You were the chair of the academic assessment and development at Universidad Anáhuac.
Right.
And then educational consultant at Easterseals. So tell us about those experiences.
Yeah. Well, I continue my journey, as I said, and always learning and always really moving along the areas of the expertise or the programs that I really like. So one of the things that, for example, working in Easterseals, and that was back in Michigan, in Detroit, I was working with them in order for, actually with the kids for migrant kids, where at that time were maybe still true today, they were having the highest level of dropouts in school. So one of the things that I did is that this program that, first of all, research in trying to understand what are the main causes, and again, tapping about the social determinants of health, right? And how all this impacted in her really in their careers, and how they were not able to concentrate at school and eventually to leave school. So we put together some, after having some data around the different issues that they were confronting, some of the interventions that could be effective in that program. And we did that for the state of, not only the county, but the state of Michigan. So yeah, so I continue with my journey, I would say, in education and learning more about working with communities. And I love that. So if you see at most of my career, even though I have, mostly in my leadership positions, I have always kept my foot on the ground. And I love that. I need to be working with the people in the communities, if I'm in those programs, but if I'm in the higher education, just working with students, because and the communities that have, gives me perspective. And I think that's extremely important for a leader to just keep on with the perspective of reality check. That was a reality check for me, I think.
Yeah, I appreciate that, and I think that is very important, and maybe something that we should be trying to highlight more, as like competent leaders should also continue to have a pulse of what's on the ground, because it gives us perspective into the work that we are doing and leading. So
absolutely, you have to do that. Yes.
And then, reflecting on your tenure as the dean at the National Institute of Public Health, what were some of the biggest transformations you led?
Yeah. So then is where I started to work in public health. So I can tell you that in 2004, the general director, and let me tell you that in Mexico, we have like here, the NIH, which are research institutes. We have the National Institute of Public Health in Mexico, and one of them is public health, right? And in that, the School of Public Health belongs to the National Institute of Public Health. So I was hired as the dean, and I was like, oh my God, public health, what is public health, right? But talking about it with my colleagues and even the general director, they look interesting because they were looking at somebody with my experience, with my profile that came from the higher education, because all my life I have been in higher education, right? So I knew how to run a school. I have in my previous positions run schools of education. But this was the School of Public Health, right? So I started to work at public health on, oh my God, I was fascinated with public health. And that's why for more than 20 years now, I'm here to stay. So I said, this is my world. And this is my world because it is really where I combined my two loves, which was education and public health. Because remember, before I have been having this encounter with the social determinants of health and public health without knowing that it was public health and it was social determinants of health, right? But when I understood that, I love it. And so I stayed there, and some of the things, and I stayed there for 13 years as being the dean of the School of Public Health there. And we did incredible things, such as, for example, the international accreditation here with CIF, which is the accreditation body here. And of course, I started to belong to ASPPH, which is my current position now. And so we open with that the opportunity for more international schools actually to be accredited here and belong to ASPPH. In 2007, remember that I studied educational technology back then when nobody talked about technology? Well, in 2007, we opened the first MPH completely online. So that was incredible for those times. Right now, of course, everybody has that, right? Mm-hmm. But at that time, it was like, oh my God, what are you doing, right? Like, it was so novel and so unusual, but it was great to really to be able to do that. And other things that we've actually re-engineering the whole educational enterprise, and we started the Lifelong Learning Center, which it was non-existent there. So the INSP, the National Institute of Public Health in Mexico, started to offer lifelong learning courses to all the states. So all the public health workforces started to really be trained by the National Institute of Public Health. Other things, we launched the faculty development certificate in order to really certificate all our faculty in order to really have the competencies to be, faculty at INSP. We changed the whole model of education at INSP being a competency-based education. We really invest in a lot of technology in order to all the classes to have really the technology that they needed in order to really have more engaged education. So those were some of the things that we did, but it was an incredible, for me, learning opportunity and development and growth at that time for the School of Public Health in Mexico.
Yeah, to talk about growth. So from that position, you then shifted into the position of President and CEO of ASPPH. How did you step into this role, and what have been your biggest priorities?
Thank you, Mari. Oh, well, that's really, for me, a fascinating story, because let me tell you, in 2005, when I was just, hired to be the dean at School of Public Health, the very first thing that I said is like, oh, you know what? We need to have the international accreditation in the United States, right? So I came in 2005 to CIF, the accreditation body, and to ASPPH to say, hey, this is the Mexican School of Public Health that, by the way, it has 100 years old. It is the biggest, the most prestigious university in Latin America, our School of Public Health. So both of them said, you know what? We don't accredit international schools. We are just national. And I was like so intrigued. I was like, what? But public health is global health. What do you mean you don't? So I said, no, our bylaws would not allow us to do that. And I was, okay. I said, well, I think that you have to change your bylaws, right? So 2 years after that, they called me and they say, hey, Laura, you know what? We changed our bylaws. So now you can start the process. And I was, really? So we started the process and we got the accreditation. So proudly, we were the first School of Public Health outside the United States in order to have the accreditation with CIF, and then we belong to ASPPH. And then, how many years? Like 17 years after that, here I am, being the president of the same association that at that time, they said that they do not have, this accreditation for schools outside the United States. So that has been an incredible, even there, that journey, of course. And right now, I have been here for almost 8 years now. Very incredible journey here in these almost 8 years. The staff that we have here in ASPPH is an incredible, so committed, so professional. It's just outstanding. And just being able to be just working with all the deans, with all the program directors, all our community here is incredible. And of course, you know me now by now, I think. So of course, the global engagement has grown. So now we have members in 7 countries. So we're very proud to have those international connections. But you asked me about what are our some of our priorities. And of course, we're working in several of them. Like 4 years ago, we actually developed our strategic framework 2030. So we are very committed to our strategic framework with very specific goals. But just to name some of them, of course, transforming academia for inclusive excellence is one of the main things that we do, because we are in the business of education, right? And we want our schools to have the graduates that represent the communities they served, right? So we are very into inclusive excellence to make sure we have the students and we have the faculty and we have the graduates that represent really all our communities. We are developing the public health workforce. So we launched a few years ago the public health workforce at ASPPH, which has been targeting to really offer development and opportunities for the workforce. We also embrace technology and innovation in education. So we are very serious about that and really to be they're centering and giving guidelines to all our members in order to how to use now the AI and other technology in education. We also are advancing solutions to the most pressing topics of public health with all our members. Some of those topics include gun violence prevention, climate change and health, healthy longevity, and advocating for public health funding. So those are just some of our priorities. Our community right now is composed of 155 schools and programs of public health. So we represent more than 13,000 faculty members, more than 90,000 students here. So we are a very powerful association and happy to work with all our partners here and globally as well. So that's some of the things that we're doing right now, Omar.
And thank you so much for also highlighting, and I appreciate that y'all are doing the work to connect people from the community and get them educated so that they can go back to the community, because I think that that's a big part of this work that we often miss or neglect. Is just the power of those people in those spaces to develop the skill sets and then go back and transform the communities is something that we need more of.
Exactly.
What do you like most about your work?
Oh, what do I like most? Well, I can say two things. I love working with my community. Our public health community is awesome. It's the best. Those are our colleagues, our partners, our friends, really, who are so committed to improving the lives of all communities. So it's the best people ever. So I love to work with the community. I also like that we're a mission-driven profession. Our profession is a calling. It's really a mission. It's not a work. It's something that you do because it's passion about it. That really motivates me like every day. It's just to remind us the why we do what we do. And we think about the well-being and the health of everyone in this world. Oh my God, that's big. That's huge. So yeah, that's the two things that I really love about my work.
And what is most challenging?
Ooh, most challenging. Well, right now, I think that most challenging are the lack of understanding of what we do. I think the miscommunication around public health is heartbreaking. That's a big challenge. And that's something that we need to really tackle really strategically, firmly, and definitely, because that is hurting us so much. And that is not fair. Everything that we do is just so to the benefits of everyone everywhere that we need to communicate better the stories and what we do.
Yeah, and I think that is also very important, especially in today's context. I know that some people might have seen that Facebook or Meta has taken down like the content regulation, the mechanisms that they had in place there. So there's going to be more spread of misinformation, and I think to that point, more importance to have public health and the narratives of public health to be really shared.
Exactly. No, absolutely. We do really this. This is a multinational, multi-level strategy that we all need to engage in order to really fix this. Yeah,
absolutely. And in your work as president and CEO, you've done a lot of work to amplify the voice of academic public health through advocacy. Can you share a success story from your efforts?
Yeah, absolutely. Well, advocacy is one area that we do so much. And we have been very successful lately because we actually work in several fronts. Of course, with the federal at the federal level, we really work very hard in Capitol Hill, and of course, we do have our education day related to, or we have our annual meeting every year. So every year we also bring together our community to actually go and talk with all the legislators. So we do that, to educate the people how to bring your message to them. We also develop different tools and resources for our members in order to really, how do you can communicate better at your local and state level, which is extremely important. You really need to have those connections, in a better way. And then we also work with several agencies from even in the White House, for example, gun violence prevention, which it is one of our initiatives. We were working with the White House Office of Gun Prevention in order to really put the initiatives there, in order to keep on doing that. So that's why we work at that level, like federal. We advocate, of course, for funding. We are very strategic, and our voice is always raised in that, but we also educate our people, our community in advocacy efforts.
Well, thank you for the work that not only you are leading, but all the work that everyone at ASPPH is doing as well.
Absolutely.
It is essential. So appreciate you doing all that work.
Sure.
And then you're also the president of Global Network for Academic Public Health. What initiatives excite you the most in strengthening global public health education?
Well, we're very strategic about the work that we do in the global network. First of all, that global network, we initiated that global network 1 year before the pandemic, and then the pandemic hit, and we were like, oh my God, that's why it's extremely important to really work together. So we are these 7 associations like us, like ASPPH around the world. There are 7. So we come together to work, to network, and to really put together what's the plan of action. So we basically have 3 areas. The most important one is education, because we are all the schools of public health around the world. And actually, all together, we represent more than 500 institutions. So we have in the area of education, we learn what are the new approaches for education around the world. We learn together. And we collectively work, for example, with WHO in developing the public health roadmap. What are the competencies needed around the world? So we, contribute to that work. So education is one important one. Another one is advocacy. Advocacy, we put advocacy statements. We work towards just raising our collective voice in the different issues related to funding or related to other issues that are affecting some countries around the world. And of course, we are a network. So just being together, having a safe net of colleagues, of individuals that are working together is always a good thing. And we learn, we support each other, especially in difficult times. Right now, we are in the topic of climate change and health. So, for example, we are preparing a big initiative for faculty around the world in terms of how to bring content from the climate change and health space in order to put in your curriculum. So we're going to launch that course very, very soon. We think that there are going to be thousands of faculty around the world really engaging in that course. So that's one of the initiatives we do in that area. We also do another one, which is this is public health global, which is seed grant money in order for young professionals to do specific projects in their communities around the world. So we have right now more than 60 already programs or initiatives that have been funded through the global network. So those are just examples of the kind of things that we do.
Well, that's awesome. And I think just goes back to highlight how important we have to be in ensuring that we're thinking about this work from a global perspective.
Yeah, absolutely.
And before I move you on to the past week guest question and the Furious 5, I wanted to ask, was there anything that I didn't ask of you or anything that you wanted to share with us?
No, this is exciting. I mean, I can keep on just talking. I love to talk about public health. I like to talk with people that's thinking about pursuing their careers in public health. I think this is the most important, really, profession that even exists. And I think that we have a great future. There's so many opportunities open up, not just in the government, but think about the private sector, the foundations, so many things that we need to be thinking about public health. So, no, it's exciting. And thank you, Omari, for this opportunity.
Yeah, truly is my pleasure. So past week's guest question, or the question that the guest asked from last question to you is, what key insights or experiences from the past year have helped you grow and become more confident in your field?
Okay. So I think that my lesson number one will be really be more intentional about effective communication. And we have talked about this, right? We need to tell better our story because we have a great story and we somehow we haven't been able to really pass that to the public. And I'm talking right now to the public. Yes, also to the politicians, right? But to the public needs to understand better what we do. So for me, it's just like, we need to be more intentional about effective communication. The number two maybe is similar to the number one, but by doing so, we need to always listen carefully, all perspectives, not just the ones who, I agree with, my friends, my colleagues, my public health community, but most importantly, the ones where maybe we have disagreements. Maybe I don't understand why they think that way. Well, I should pay more attention. I should pay more time, listening very carefully, very respectful about why and how and when and what happens there, and try to understand all the perspectives. I think this is extremely important for our field. And maybe the last one is just be patient and focus. Always find common grounds. There's always a common ground. We need to find it. Just don't be just disappointed or despair, but there's always a common ground. We need to find it. But in order to do that, we need to be patient. We need to listen. We need to focus on our mission, and I'm sure we can find those common grounds. So for me, those were the big lessons, I think, for last year.
Great insights. So moving you along to the last section of this show, the Furious Five, the 5 questions I ask all guests.
Oh, okay.
Number 1, what advice would you give to a student trying to pursue a career in public health?
All right. A few things. First of all, build a strong educational foundation. We really need education. Because education is you already know that, it's my passion, it's my background. I strongly feel that education is your path to move forward. So just build a strong education foundation, whatever that is. It could be undergraduate education, it could be master's, it could be doctoral, it could be on-the-job education, but always pursue really the science. Be curious about the whys of science. Gain practical experience. Get involved, engaged with really practical things. And it could be, of course, a formal one like internships, field work, but also volunteering in your community to learn more. You only learn from your community when you are engaged in the community. It's very important for you to develop key skills, the current skills that are needed to really, thrive in this current situation, the current moment, such as what? Like data analysis, communication, extremely important. We have already talked a lot about this, but also critical thinking, advocacy, being active, health diplomacy. We haven't talked about health diplomacy. It's extremely important. Negotiating with the others, to really get into yes, right? Innovation and technology in public health. All of these skills are becoming extremely important for our field. Another advice will be to build your professional network. So again, be connected to mentors among your professors, among other professionals. Join professional associations. In our field, there are many at the federal level, national level, but also at your local and state level as well. Attend conferences, workshops. Always continue building this relationship and this professional network. Stay informed and be flexible. Be flexible. And you have to have the right attitude. Be optimistic about everything. We're going to go through this. We're going to look at your focus on what you really want in the long run, and just everything will add to that future. Maybe just lifelong learning. I mean, has to do with this is always be curious to learn. And of course, we talk about the global perspective, right? Always think that everything is interconnected. So it's not just, I'm glad that maybe you're thinking locally, but we always need to have the global perspective as well. So a few things.
Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
All right. Well, to step into a leadership role in public health, you must be a bridge builder. The future of public health depends on our ability to collaborate across borders, across institutions, colleagues with different perspectives and disciplines. So wherever you're leading an organization or developing policies or advancing public health education, really fostering partnerships is crucial. I would advise aspiring leaders to invest in relationships, both domestically and internationally, because the collective intelligence and shared solutions from diverse perspectives are what drive meaningful change. Stay curious, be adaptable, and never lose sight of the bigger picture. We are here to improve the health and well-being of everyone. So that would be my advice.
And then number 3, what's something you are working on improving in your life right now?
You know what? Work-life balance. It's very easy to get trapped into work, right? Or worried. And you have to stop that. I mean, you always need to also be thinking about yourself. So I'm working in adding more fun activities to my daily life, I think, to do more exercise, more walking, meditation, everything that makes you that helps you really stay balanced. It's extremely, extremely important. So, but I'm working on it.
And then number 4, and thank you for the vulnerability. Number 4,
Sure.
Professionally, do you recommend anything?
Yeah, I think in terms of staying informed, it's extremely important that you really stay informed with the news and with the journals that gets you the latest information on what's going on in our fields. And there are excellent national and international journals. Of course, the public health journals, the national ones, but also there are incredible podcasts. I can tell you that all our ASPPH members' podcasts are incredible, and all our community has really, some of them really publish articles in a weekly basis. So it depends on what you like and depends on what you want. But any of them, and of course, the Lancet Global Health Journal, which I really love for the global perspective, but of course, the national, I don't know, all of the, I'm tempted to say names, but all our members have really incredible podcasts and really articles in a weekly basis. You need to find them and just look at the ones that you like. I also enjoy listening and for example and watching the TED Ed Health. They always have inspired conversation as well. But those are the things that I think I recommend.
And then number 5, last but not least, if there was one piece of advice you'd give your younger self, what would it be?
Take more risks. Even though I have, but I think take more risks. Embrace failures as learning experiences. It was not a failure. It's really a learning. You learn a lot. Build strong relationships with mentors and peers. Because I think that public health is about teamwork and lifelong learning. So I would say those are things that it needs to stick with you always.
Well, Dr. Magaña, this has been an amazing conversation, some great insights, and I really, really enjoyed your perspective that you had to share with us today.
Me too. Thank you so much for the opportunity. I love it. I really enjoyed every minute of it. Thank you so much. Thank you all the audience so much.
It truly, truly is my pleasure. And I know people are going to get a lot of value from this episode. Housekeeping items. Thank you all so much for watching or listening to this. Be sure to hit that subscribe button if you have not as yet. Leave a like, leave a review, and share it with a friend. Greatly, greatly appreciate you all. And we'll see you all next week. Bye, everyone.
All right. Thank you. Goodbye.